Have you ever experienced any of these symptoms? Heavy menstrual bleeding, pelvic pain, or frequent urination? If yes, you might want to listen closely. Welcome to a discussion that could potentially change your life, or at least your well-being. Today we're talking about uterine fibroids, non-cancerous growths that develop in or around the uterus. While these fibroids are usually benign, they can cause a series of discomforting symptoms that might be disrupting your everyday life. Understanding what uterine fibroids are and recognizing their warning signs is the first step towards empowering your health. This knowledge can help you make informed decisions about your body and potentially catch these growths in their early stages. We're not just talking about recognizing a single symptom, but rather a collection of signs that, together, might indicate the presence of fibroids. So sit back, perhaps grab a notepad, and prepare to empower your health. Join us as we delve into the 12 warning signs of uterine fibroids. First on our list is heavy menstrual bleeding. This is one of the most common symptoms of uterine fibroids. It's not just about having a heavier flow than usual, which in itself can be quite distressing. It's also about periods that last longer than a week, or having blood clots in your period. This happens because fibroids can affect the way the uterus behaves during your menstrual cycle, causing it to shed its lining more heavily or for longer periods. Now let's move on to the second sign: pelvic pain and pressure. Fibroids are essentially muscular tumors that grow in or on the uterus. As they increase in size, they can cause a feeling of fullness or pressure in the lower abdomen. Imagine having a constant weight pressing down on your pelvis. That's what this can feel like. The pain can range from a dull ache to a sharp cramp, and is often constant rather than coming and going. Our third sign is frequent urination. You might be wondering, what does my uterus have to do with my bladder? Well, the uterus and bladder are close neighbors, so when fibroids grow large, they can press against the bladder, causing you to feel the need to urinate more often. It's not just about the number of trips you're making to the bathroom, but also if you're waking up multiple times at night to pee, or if you're unable to hold in your urine. It's important to note that these signs are not exclusive to uterine fibroids. Conditions like hormonal imbalances or other reproductive health issues can also cause these symptoms. That's why it's essential to have open discussions with your healthcare provider. They can help you understand what's going on and guide you towards the best course of action. Remember, experiencing these symptoms does not necessarily mean you have uterine fibroids, but it's worth discussing with a healthcare professional. Moving forward, we have pelvic pain during intercourse. This is a common sign of uterine fibroids. The presence of fibroids can make the uterus more sensitive and irritable, causing pain during intimate moments. This symptom can be especially distressing as it can affect your relationships and emotional well-being. However, it's important to remember that pelvic pain during intercourse can also be linked to other conditions, so it's crucial to consult with a healthcare professional for a precise diagnosis. Next up, we have lower back pain. Fibroids, especially those that are located at the back of the uterus, can press against the spine and pelvic nerves, causing discomfort in the lower back. This pain may seem unrelated to your reproductive health, and you might dismiss it as a sign of age or physical strain, but if it persists and is accompanied by other symptoms, it could be a sign of fibroids. Now let's talk about an enlarged abdomen or bloating. This can be a more visible sign of uterine fibroids. Large fibroids can make your abdomen appear swollen or larger than usual. It's as if you're carrying a weight in your belly, and it's not uncommon for women with large fibroids to be asked if they're pregnant. This bloating isn't just a cosmetic issue. It can also cause discomfort or a feeling of fullness. Remember, these signs, pelvic pain during intercourse, lower back pain, and an enlarged abdomen or bloating, are all potential indicators of uterine fibroids. They can disrupt your daily life and may even affect your self-esteem. But they are also signals from your body, telling you that something isn't right. However, it's essential to remember that these symptoms can also be associated with other health issues. Therefore, if you're experiencing any of these symptoms, it's important to consult a healthcare practitioner. They can help you understand what's happening and guide you towards the best course of action. Again, these symptoms alone do not confirm the presence of fibroids, but they are worth noting. Next up, we have constipation or difficulty with bowel movements. This might seem like an odd symptom in relation to uterine fibroids, but it's more common than you might think. Uterine fibroids are benign tumors that develop in or around the womb. If they grow large enough, they can put pressure on the bowel, leading to constipation or difficulty with bowel movements. Now, it's essential to remember that constipation can be caused by a variety of factors, including diet and stress. So experiencing constipation does not automatically mean you have fibroids. However, if constipation is persistent and accompanied by other signs we've discussed, it could be a sign of uterine fibroids. Our next sign is fertility issues. Uterine fibroids can interfere with the fertilization process in a few ways. They can change the shape of the cervix, affecting the number of sperm that can enter the uterus. They can also change the shape of the uterus, which can make it more difficult for an implanted embryo to grow. In some cases, fibroids can block the fallopian tubes, preventing the sperm from reaching the egg. If you've been having trouble getting pregnant, it might be worth discussing the possibility of fibroids with your doctor. Lastly, for this section, we'll discuss pain or frequent discomfort in the pelvic area. This is one of the most common signs of uterine fibroids. The tumors can cause a feeling of fullness or pressure in the lower abdomen. They can also cause pain during sex, as we discussed earlier. If you're frequently experiencing discomfort or pain in your pelvic area, it's important to communicate this to your healthcare provider. Each of these signs is an important piece of the puzzle in identifying uterine fibroids. They might seem unrelated, but together, they paint a picture of what's going on inside your body. If you're experiencing any of these symptoms, it's crucial to discuss them with your doctor. Remember, early detection is key in managing any health concerns. Finally, we have leg pains or backache. Let's delve into these last three signs and understand what they mean, why they happen, and how they connect to uterine fibroids. Firstly, leg pains or a backache can be a warning sign of uterine fibroids. This pain is not the typical discomfort you might feel after a long day on your feet or sitting at your desk. It's persistent and can be severe, often because the fibroids are pressing on the nerves that lead to your back and legs. This kind of discomfort can disrupt your daily routine and may even affect your quality of sleep. Next, we have abdominal swelling or a visible lump. This sign is usually more noticeable with larger fibroids. Your abdomen may appear bloated, and in some cases, you might even be able to feel a firm lump. This happens because the fibroids are growing in your uterus, which can cause it to expand. It's important to note that while this sign may seem alarming, uterine fibroids are usually benign or non-cancerous. However, if you notice any changes in your abdomen's size or shape, it's crucial to seek medical advice to rule out other possible conditions. Finally, anemia is another sign of uterine fibroids. This condition, characterized by a decrease in red blood cells, can occur if you're experiencing heavy menstrual bleeding, one of the other signs we've discussed. When you lose a lot of blood during your period, your body might not have enough iron to produce new red blood cells, leading to anemia. Symptoms of anemia can include tiredness, shortness of breath, and pale skin. If left untreated, anemia can affect your overall health and well-being. Understanding these signs and how they connect to uterine fibroids can empower you to take charge of your health. If you're experiencing any of these symptoms, it's important to consult with a healthcare professional. Early detection and treatment can make a significant difference. And that, friends, wraps up our list of 12 warning signs of uterine fibroids. Knowledge is power when it comes to your health. And it is this power of knowledge that we've tried to impart to you today. The 12 warning signs of uterine fibroids we've shared, from heavy menstrual bleeding to anemia, are key indicators that something might not be quite right. These signs are not to be ignored or brushed aside, but rather they serve as important signals that your body is trying to communicate with you. Acknowledging these signs and taking swift action can make a world of difference in your health and well-being. Should you recognize any of these symptoms in your own body, we strongly encourage you to seek professional healthcare advice. Your health is your wealth, and taking care of it should be your top priority. Please remember to subscribe to our channel. When you do, it helps us to create more informative videos like this one. And remember to click the notification bell. If you learned anything valuable, please share the video with family and friends. Remember, your health matters.